confusing. Here to discuss what parents need to know is Associate Professor of Pediatrics at George Washington University, Dr. Evan Nadler. Doctor, good morning. Welcome.
Morning, Hannah. Thanks so much for having me.
Thanks for coming. Yeah, this is confusing. A lot of parents have questions. So let's go back to that advisory board. They voted unanimously to remove the COVID-19 vaccine from the CDC's recommendation list. You're a pediatrician. You're an educator. How will you advise your patients moving forward when they come into your office with this news?
Right. So, confusion reigns supreme right now with the COVID recommendations. So the FDA approved the new vaccine for people over the age of 65 or those with a health condition that would predispose them to a more significant infection should they get one. But then the ACIP and the CDC remove all recommendations and suggest that it should be what's called shared clinical decision-making model, which is talk to your doctor and get an opinion, which is kind of sort of a non-decision. It's kind of like punting the responsibility to the doctors, which I guess is fine. But then they also voted that you don't actually need a prescription for getting the vaccine. So I don't even know how anyone's going to document or prove that they talk to a doctor before going to get a vaccine if you don't need a prescription. So to me, the whole thing is just kind of a mess.
Yeah, I'm sure pharmacies are figuring out what to do as well. The panel also voted against recommending that combination we were talking about earlier, the MMRV vaccine for children under the age of 4. Doc, you're a pediatrics professor. What is your advice to parents who are not sure if vaccines are the right choice for their child this year?
Right. So the one positive of the panel's recommendation is that they did recommend that people speak to their provider about these things. And thus, the data that hopefully your provider will share with you if you're a parent and have some concerns will just be the medical data that are out there, not the politics that have sort of infused themselves into medicine, which, before COVID really didn't exist. So, with the MMRV combined vaccination, there is a slightly higher risk of what are known as febrile seizures. So there is a risk, and so that's a real consideration. And so right now, 85% of people still separate those two vaccines anyway. They get the MMR vaccine and then the varicella vaccine separately. But there was this option to get them in one shot combined. So now that that's no longer an option for those under 4, really it's, goes to the, you just have to do what the 85% of the people were already doing.
Sure.
Separate shots.
That actually helps me. Thank you. Because you say, that's a little less confusing. Amid the restrictions, the advisory panel decided to hold off on significant changes to the hepatitis B guidelines, also for children under the age of 4. When can we expect that to reconvene, Doctor?
Yeah. So it was pushed off indefinitely, which I think is a signal that the data. So this administration has talked about radical transparency and gold standard science in a lot of their sound bites. And the radical transparency and gold standard science would mean that you actually have to have the science to support the decision, and then you would let the public see those data and those studies. And I think when it came to hepatitis B, they realized that they didn't really have any leg to stand on in terms of the downside of getting that vaccine. You can argue either way when there's no data available, but there's certainly no data to suggest that the hepatitis B vaccine causes complications, and there's lots of data that shows that it has basically changed the number of children who had hepatitis B from in the hundreds of thousands back in the early 1990s to almost zero now. So that's going to be a tougher road to hoe for the ACIP because the data really don't support changing that vaccine schedule.
All right. Well, hopefully you answered a few questions that parents have. We hope to get you back on. Dr. Evan Nadler, really appreciate your insight and context. Thank you again.
My pleasure anytime. And it is confusing, so reach out again if we need more explanation.
Absolutely. I have a feeling we will. Thank you so much. And